among grieving families and New York State's entities who will bear the increasing liability of insurance premiums. Eyewitness News reporter Vera Shang has the details.
The bill, known as the Grieving Families Act, amends the state's wrongful death law by permitting families to recover non-financial damages for emotional anguish if their loved one was a victim of wrongful death. And it also redefines close family members and broadens the range of potential plaintiffs to unmarried and domestic partners. In addition to this, the Act extends the window of bringing a wrongful death lawsuit from within 2 years to 3.5 years. Dating back to 1847, when the existing law was first written, it was considered to be one of the best laws across the country. Given that it has not been updated in the past 170 years, now people are arguing to reform this law in order to better reflect the society as it is in 2022.
So if you are a hedge fund manager on Wall Street, your family gets compensated considerably. If you're a senior citizen or a child or poor, your family does not. We don't think that the value of the person should be measured purely in economic loss, because the loss is much greater to the family.
5 years ago, Sabrina Bonanza lost her fiancé and her infant son's dad when a car pulled out in front of his motorcycle in Utica. Sadly, she's not alone. There are hundreds of people who lost their loved one to wrongful death who are urging Wrongful for this new change. Public and private entities have raised concerns with the negative effect of this reformation.
So this bill would essentially increase costs for all New Yorkers at a time when we are facing some of the highest cost increase that we've seen in 40 years. This bill would increase the cost for doctors by over 40%. So many different groups that have been in opposition to this. Obviously, the medical groups, which are incredibly strapped and only now just recovering from the COVID-19 pandemic. We also have things like monkeypox on the rise and polio coming as well. So this is a terrible time to be increasing the cost on our healthcare professionals. They are incredibly strapped, and any investments that Governor Hochul has made in healthcare would essentially be washed away if this bill were to pass.
He argues that the bill would actually devastate people of lower income.
This bill would vastly increase their costs, which would dramatically hurt those lower incomes people's access to care at a time when these hospitals are closing. They're already struggling to get that access to care, and this would make that much worse. We'd also struggle to attract the best doctors, and that would make it more difficult for those lower income communities to attract doctors to practice in their areas.
Now, people are anxiously waiting for Governor Kathy Hochul to either sign, veto, or negotiate for changes with the executive leaders of both houses.
Because it passed both houses, the Assembly and the State Senate, with overwhelming bipartisan majorities. This is not an ideological issue in the sense of partisanship. This is really just an issue of fairness.
Reporting in Utica, Vera Shang, Eyewitness News at 10.